I'm Dr. Bill Burman, the Director of Public Health at Denver Health. The overall COVID situation in Denver is stable. The case numbers are pretty stable, perhaps slowly decreasing. The other metric we often looked at is the percent of tests that are positive, percent positivity. That remains under our goal of 5%. It's about 2.8% today. Vaccinations continue to go well. Just one landmark that we passed in the last day or two was more than 100,000 people who have completed their vaccine series in Denver. So that's great. And we're told by the state that the supplies of vaccines are going to increase substantially over the next few weeks. The vaccination eligibility has opened up markedly in this past week. Check it out, see if you're now eligible and get vaccinated. The governor is expected to make an announcement very soon, but we think by mid-April, all persons 16 and older will be eligible for vaccination. I think the first thing is to hang in there. As I've said, vaccinations are increasing, and we expect that rate to even increase more in the next month. And so we really are reaching the point at which vaccination can help us turn off this pandemic. We don't want to have a surge before we get to that point. We want to avoid that in our community. It has all kinds of potential problems, including hospitalizations, deaths, more trouble keeping schools open. We are getting close to the finish line here, and we don't want to blow it. Some specific advice about traveling. Airlines require universal masking. That's good, and I'm told they are very strict about that. For cars, think about who you're in the car with, because ideally that should just be the small number of people who are in your pod, family members, the persons who you're with all the time. So take multiple cars if you need to, but stay within your pod because it's difficult to not share the same airspace in a car. Decrease your risk of exposure to indoor dining restaurants. That's clearly a place in which transmission can occur. There are plenty of opportunities for doing other things, take out, make your own food, etc. For gatherings, I think the CDC guidance is good. To ideally limit those to families, limit those to vaccinated people, keep those small. Just the basic advice of outdoors is much, much better than indoors. So whatever you can do outdoors, from recreating to eating outside, it's better. And then finally, to think about testing. Testing is broadly available, it's free, it's available in a number of places in the community. And so people can consider using testing before, after, both, as yet an additional measure. But I think the key things are to hang in there, don't let down your guard. We are really getting towards the end of this.
We think back on the last 3 months where we reopened our schools to many students for the very first time on a grand scale. And I'm happy to report that we've had great success. Week by week, month by month, campus by campus, we've slowly grown the number of students who are participating in in-person learning. What we have seen is very rare transmission in our school buildings, which is exactly what the research has shown around the world. That when we mask and we space in the way that we have been doing, that we will avoid giving each other COVID in school buildings, making our buildings incredibly safe. And we look forward to the continued expansion of our in-person learning plan following these safe protocols after spring break. We have, in fact, continued to look at the literature and the research and looked at other models around the world, and are happy to report that we're able to lift some of the restrictions that made in-person learning difficult before. When we come back from spring break, much of the mixing that was prohibited amongst middle school and high schoolers will no longer be the case. We'll be able to mix our cohorts in ways that we weren't able to before. We look forward to the warmer weather. The warmer weather will allow us to have more activities outside. Again, we know from lots of examples that outside is safer than inside when it comes to COVID. So although we've had tremendous success from January to March this year and are continuing to grow our in-person model, the post-spring break opportunities are even greater.